So welcome for today's topic. This is a very short and crisp one, that is the cobblestone appearance in the subcutaneous tissue. What is cobblestone appearance? You can make out by this picture. This is a very common design in houses, even in interiors. So you could see some bright areas and then these dark lines. Now, before I go on to the significance of the cobblestone appearance, let us see how the subcutaneous tissue looks. Now, if you see to this picture, you can make out that this area is the skin. Now, skin has epidermis and then the dermis. You can see this white line, this is the dermis, which is thin and bright. And next to the dermis, we have the subcutaneous tissue. This is a subcutaneous tissue. Now, subcutaneous tissue is predominantly having fat. Now, fat, as you must be knowing, has a varied appearance. In some areas, it is dark, and in some areas, it is bright. When it has more of fluid, it is predominantly bright. The reason being, fat and fluid, they don't mix and they create a lot of interfaces. So more the interfaces, more the reflection, and more is the brightness. Now, here you can see that this subcutaneous fat is predominantly dark and it just has a few bright strands in between. Otherwise, it is dark. Now, this subcutaneous fat area can be well seen in the abdominal wall, and even in the breast area, limbs. Now, this picture is with a high frequency probe, and let us see to this picture now. Now, this picture is different from this in the sense, number one, if you see here, this area, which is a subcutaneous area, which should have fat, has a lot of bright patches. Can you remember what these bright patches? And next to these bright patches, there are dark areas. Now, these bright patches are fat. But why the fat here is bright? The fat here is bright because of fluid. As I told you, fat has a varying echogenicity. Where there is more fluid, it appears brighter. So you could see this fat, and in which conditions the fat can have more fluid? In conditions like inflammation or edema. Now the question here is, this is fat, this is fluid, and you can compare with this cobblestone appearance, similar, yes? The question is whether this cobblestone appearance is due to subcutaneous edema or it is due to cellulitis, inflammation. How do you make out between the two? One important thing is clinical. We all know that wherever there is cellulitis, it will be having overlying skin, which is red. Overlying temperature may also be increased. And on ultrasound, what you can make out is, number one, the skin. You can see the dermis part, which is next to the subcutaneous tissue. The dermis here can be made out as thick and irregular. You can see here the thickening is more throughout, but it is irregular. Here it is more, but not as much as here. See here, the dermis is very thin and very regular, but here you see thick and irregular. Now, when you find dermis being thick and irregular, it favors cellulitis rather than simple edema. Now, the other thing you can make out is with Doppler, once you put color, you can see there will be patchy areas of flow along these bright areas which represent the fat. This will not be seen in simple edema. Why? Because here the fat is inflamed. It is having fluid due to inflammation, and in edema the fat has fluid but there is no inflammation. So basically, again, a very simple thing, cobblestone appearance in the subcutaneous tissue represents either edema, simple edema, or cellulitis. It is important to differentiate between the two because cellulitis is a fast spreading inflammation and it needs to be treated with antibiotics. So that's all. Thank you so much.